acute low back pain can be a scary phenomenon. It may be that you've simply bent forwards to do the washing up, you've been cleaning your teeth, really trivial movement, and all of a sudden the back's gone. Not sure where it's gone, but either way, you've been left in debilitating pain, and we need to know what to do about it. And so really, when you're in these acute episodes of low back pain, again, the same with other areas of the body, we want to try and ascertain where's that pain coming from. Because in acute pain, there must have been some form of tissue damage. Now, this might just be a very minor overstrain, and in most cases, it is. But if you've had pain in the past or low back pain in the past, it's more likely that your future episodes of pain, until everything is resolved, may be a little bit more protective because the brain recognizes, well, I've had this injury before, I've done it again, I need to protect you even harder. And so we can use the normal things like ice and heat just to modulate the pain. And that's just to manage and get you by. And you can go through the pain management section of this website to find out all the ways in which we recommend management of pain, just for symptoms, not resolution in the short term. If you're getting pain down the back of the leg, we want to find out, is it a sharp shooting pain? Is it an electric shock like pain? In which case, this is usually because of nerve irritation, and this is typically a sciatica, although most low back pain isn't sciatica. But if you're getting electric shock like symptoms down the back of the leg in kind of short bursts, then this tends to be more inflammatory, where inflammation is sitting around that nerve and causing it to send off signals down the back of the leg. If it's more of a vague, diffuse, kind of non-specific pain in the back of the leg, then this is more of a referred pain. Again, usually from the low back. So there's no point in putting that ice or heat on the leg. We want to put it only on the back. As with all acute injuries, movement is key. But the most important thing is not overdoing it. And it sounds simple, but I've never had an acute low back patient that hasn't overdone it. And so the way that you manage this is you need to break your day down into chunks and intervals. So really, in an acute low back pain episode, your whole day needs to revolve around your back. And it's just the way it is, unfortunately. You can't be doing your normal day-to-day and expect not to aggravate that problem, because your body has gone into a really protective mode because it fears danger. And so we need to now make it feel safe once again, whilst that normal healing cycle is taking place. How long is a normal healing cycle? 2 to 3 weeks, okay? It will get better. It will always get better. But the key thing is how you manage it in the early phases. So you might do a 10-minute walk and then lie down on the back or lie down on the front, whichever's more comfortable for you. It depends on what the issue is. If it's a sciatica type problem, then usually lying on the front is going to be more helpful. Otherwise, generally laying on the back, little pillow under the knees to break the bend of the knees. And you need to be breaking the day up in this way. So at least 5 or 6 times in a day, we want you lying down for 5 minutes, because lying down is the only time you're going to be away from gravity. Sitting, standing, walking, you've all got compression going through the spine, and this tends to be the most aggravating thing. And so those muscles are going to fatigue a lot quicker under those circumstances. So it's really important that you break the day down, you put it into chunks, you do a little bit of movement, lie down, a little bit of movement, lie down. Because that's the only way you're not going to get to the end of the day and have a lot of pain. Oh, my pain's worse in the evening. It's usually just because the muscles are so fatigued. It's not because you've aggravated any kind of damage in the low back at all. So that's the first thing. Of course, keeping hydrated with water, super important, because the discs in the low back are made of a lot of fluid. So it's important that we give the body the best nutrition possible for a healing cycle to take place. So that's really important. So when it comes to doing any kind of specific movements when you're in an acute flare-up, the movements that you want to do can actually differ depending on the pain that you have. So if you're struggling with bending forwards, that might be causing some pain down the back of the leg, then we want to consider doing these types of exercises. If the pain that you're getting is worse when you're bending backwards or you're struggling to straighten up, then we want to consider these type of exercises. To summarize, most acute back pain will heal because even if there is a small amount of structural damage, that's going to heal and inflammation is going to take its course over 2 to 3 weeks. It might be quite painful during this period, but we want to try and encourage that process as much as possible. Therefore, we want to really avoid taking any anti-inflammatories in the first 72 hours because we need that inflammation to promote a healing response. We're also going to avoid any ice in the short term because that's going to actually shut down the blood flow to the area. Although it may cause some analgesic effects and actually help with pain, it may prevent the healing in the long term. So use some heat instead. We also need to make sure that we are breaking the day down into chunks, getting away from compression, lying on the back or the front, depending on what's most comfortable for you, for times of around 5 minutes, multiple times per day. You can also check out the diagnosis area of the website for some more specific information depending on your particular issue, which may be a little bit more tailored. So for example, it could be sciatica, could be spinal stenosis, could be a radiculopathy. And we're going to have different information for you depending on which specific condition we've told you that you might have. When you can't avoid sitting, or it's part of your work and you simply can't get any time off during this acute period, we can use a specific type of backrest to try and at least get some support on the back during this painful period. And you'll find a link to this just to the right hand side here, linking to that you can purchase.